Hello, this is Theresa Baker, and today we're going to be talking about electronic informed consent with REDCap. Informed consent is when we tell the participant that is preparing to participate in a clinical trial all about the study, make sure that they understand what's going to happen, that they comprehend it all, that they are making an informed decision about participating in the study, that they understand the risks and benefits, and any questions that they might have the ability to be answered. So there are 8 basic elements of informed consent, and we're going to go through all 8 of them now. The first element is description of the clinical investigation. You have to have some kind of statement that tells the participant what's going to be happening and why it's going to be happening. The second element is a declaration of the risks and discomforts that the person can anticipate um, throughout the trial. The third element is any benefits that the participant might reasonably expect from the research. And the fourth element is any alternative procedures or treatments they may go and have in lieu of this specific study's intervention. The fifth one is confidentiality. You have to have some kind of statement that explains what's going to happen to the records and who would have the ability to see the records and that kind of stuff. The sixth element is any compensation or medical treatment that the person can have if they have an injury because of the medical treatments that occur or anything that might happen within the parameters of the protocol. The seventh element is contacts. You have to give the participant the ability to contact the IRB, to contact the PI, to contact the study coordinator. And so you have to, and when they contact them, you have to be able to um, competently give back answers and responses to them in a timely manner. So they have to have contact to people that are doing. They have to have contact. Have to have the ability to have contact with the study team. And the last element is that they voluntarily participate. So there has to be some kind of acknowledgement or statement that they have the ability to refuse and that nothing untoward would happen to them. They would lose no benefits or have no penalties if they decide to stop participating. So these 8 elements together are are what compromise informed consent. And there are a few things that we need to do to document that we have actually had informed consent. So, um, typically, you would have to have a signed and dated written consent form, and you also need to have a process note that the consent occurred and how it occurred and the process that that particular person was consented to the study. So those two things are the usual. And a copy of that consent form needs to go to the participant. So that's the norm. Um, but however, occasionally the IRB allows for a waiver of written documentation of the informed consent. The individual still has to have an informed consent process. They are just waiving the requirement for written documentation. When this occurs, you still need a process note, and typically the IRB will ask that a written statement about the study is provided to the individual consenting if they are not having a signed document. So the FDA does allow for alternative methods to be obtained when you are doing informed consent. As new technologies arise, then there will be a difference from the typical face-to-face interview conversation of what consent has been in the past using a paper consent form. And so the FDA understands that future technologies might have alternative methods, and they have written into their documentations the ability for future technologies that are currently unknown to allow for informed consent to occur. The requirement is that the 8 elements of consenting have to be present on no matter what technology is used. So when we talk about the documentations themselves, there are two ways that you could document the informed consent. The first one is the one that we typically see. It's the usual, which is the long form. And this long form has all the elements of the informed consent. At the end of it, the consent form is stored in the investigator files, and a copy of it is given to the participant. But there is another method that you could have, which is called the short form. So this does not occur very often. This occurs when there might be a situation where the consent needs to be presented orally to the participant. And when this happens, you have to have a witness to that oral presentation of the consent process. And afterwards, the participant needs to sign the consent form if they agree, or I'm sorry, they have to sign the short form consent form if they agree. The witness has to sign the short form, and the IRB is required to have documented that a written summary of everything that occurred during the the consenting process, and the witness has to also sign that document. A copy of both the summary and the short form are then provided to the participant. So, an example of when this might happen is if let's say that your approved long form, your approved consent form is in English, and you have a Spanish speaking participant, and you have to call the translator, and you've got to consent the participant with the translator. So you would then, in that case, you could use the translator as the witness, or you could use another person as the witness as long as they could understand both languages. Okay, so let's talk about what that process looks like. And this is kind of a big umbrella. There's sometimes nuances in here, but your first section of the informed consent process starts with introducing the study to the participant and inviting them to participate. So if you are doing a study that has flyers or is sending out information on the radio or on TV, or in the ads or anything, your informed consent process actually starts right there. The very first time the participant is seeing information that is put out by the study team or the protocol. Um, After the person is invited to participate, there is usually some kind of pre-screening for eligibility. And if it's a clinical trial, you might have to do like a screening visit and an enrollment visit. But if you're not having a clinical trial, if it's an observational study, then your eligibility might be within, both the screening and the right after consenting, or it could be after consenting, depending on what kind of study you've got going on. After you have presented all of the information, at this point you move to the next step, which is where the participant gets the chance to ask questions, have a discussion with you, and you get to assess whether they understand what's happening, and they get to kind of reiterate if they understand what's happening. And after you go through the comprehension steps, you enter into the decision time, and this is where the participant takes the energy and time to to decide whether they want to participate or not. After that decision has been made, if they decide no, you still have to document that they said no in your process note and then your screening logs, but they go on their way and you have that's it. You're done with that particular person. If they say yes, then you need to document that they said yes. You need to that's when you give the copy to them, and that's when you have a copy for yourself or the original for your files. And you also need to do the process note at that point. So that is the informed consent process. Now, when we're talking about taking this process and transitioning it to an electronic form, what we're really talking about here is including multimedia components that might be developed, or having some kind of interactive or engaging pieces within the consent form, or having some kind of um, flexible learning styles engage in the process. So a lot of people think of this as just taking the paper and putting it on a computer or a tablet, as in taking a PDF and leaving it in electronic. Don't ever print it, don't ever have a stylus. But really, electronic informed consent means that maybe you have a video, maybe you have questions and feedback that happens right within the consent process. Perhaps you have a presentation of the PI explaining the study before you enter into another piece, or it could be a group piece and then an individual piece, or it could be one-on-one conversations through a webinar or um, virtual conversations on the phone and with an electronic form in front of the person. So there's lots of different options, I guess, is what I want to get across here when you're talking about electronic informed consent. You are discussing more than just having a piece of paper on an electronic device. You're talking about using sound and video and music and elements that are in an electronic device to help the person comprehend what they are preparing to say yes to or no to. So when we talk about electronic consent, I always like to make sure that I bring up the 21 CFR Part 11 compliance aspect of it, because 21 CFR Part 11 is the guideline that talks about electronic records and electronic signatures. Now, if you are not doing an FDA study, you don't need to worry about this, but if you're if you are doing an FDA study, this is an important aspect. And even if you're not doing an FDA study, it's good guidelines or best practice to work within the confines of 21 Part 11 compliance if you're capable of doing it within the system you're in. So, what does that mean? Well, Part 11 has these three major provisions in it. And I don't want to take too much energy and time, but I want to give you enough to understand the bigger picture of what's happening here. So, there's all these different subsections that are inside these three provisions. And the important ones are Subpart B, which talks about your electronic records, and Subpart C, which talks about your electronic signatures. So, when you're talking about Part 11 compliance, you are looking at anything that applies to an electronic data record, any signed consent forms, an electronic signature, which means we'll talk about this more in a minute, but it's an authenticated login signature, basically, or a biometrics. Source documentation that's electronic, those kinds of things are what we're applying Part 11 compliance to. But there's really just three major broad themes you kind of have to consider when you're thinking about this. Is it secure? Is it traceable? And is it trustworthy? Those are the three you really need to kind of think about when you're trying to make sure that you are in a system that is Part 11 compliant. And in order to make that happen, you have to go through something called a validation, which is called the short term for it is an IQ, OQ, PQ. And there's three different pieces of it. And I don't want to give you too much here. What I really want you to know is that the last one here, the PQ, inside, when we're talking about making sure eConsent is done correctly, or honestly, any piece, the study team is responsible for making sure a PQ is performed. And this is where you test and document your study specific processes and performances and any user specifications you might need to have in the electronic system you are going to use. This has to be done in any electronic system, including things like a shared drive or a like something like an EDC like Rave, and then also obviously in REDCap. So what is REDCap? REDCap is a research electronic data capture tool, which is it's a web-based application, which means you can log into it from anywhere at any time. And its entire purpose is to collect and store data. That's it. All it does is collect and store data. It was built by researchers for researchers. It is intended for clinical trials and um, for anything that might need to be HIPAA compliant. So there's really kind of three parts of REDCap that you need to think about. You have to think about, how do I get the data into REDCap? Once it's in REDCap, how's that data being stored? What's the structure of my project, or what does my form look like? And how is that data, how's that information stored? And then lastly, how do I plan to get my information out of REDCap? So REDCap is really there to help you get the data in and help you store the data. At some point, then it has to come out for you to do other things with it usually. So in the data collection is where we would use the eConsent framework when we're talking about informed consent, so that we can help us stay compliant during the collection process of a consent documentation. And for the data storage, Auto Archive will automatically put a static copy of the PDF of the consent form into the file repository. And then our export allows for us to do individual or bulk exports of the consent documentations. Okay, so when I go back to that informed consent process and we start to layer the possibilities of what REDCap could do, we have to start thinking about what are the functions inside REDCap that might be capable of helping us at any one of these pieces of the process. So in the first one, during the information provided section, you could have a public survey link or for an invitation for the participant, or you can even send an electronic invitation directly to someone who you have on a list that might be capable of being in the study. So that can be done manually, where using the survey distribution tools, which is one feature. But another thing you could set up is you could use what's called ASI, and ASI stands for, actually, I think it's AIS. Ooh, typo. Auto, oh no, it's right. Auto Survey Invitation, ASI. Had it right. So that's where you automate an invitation to a person. And now a newer feature that has been on the market recently is also called alerts and notifications. You could also use alerts and notifications to send an invite to a participant for them to start a screening process. So once they enter into a web page, you could then start some screening instruments, just broad picture screening instruments before you had that one-on-one conversation piece with them. You could present the consent information at that point. You could, and then you could have the e-consent framework enabled for the person to be able to document, um, to have attestation that they consent to the study. And during the next kind of piece of the process, during the comprehension piece, you might be able to have some questions built into your e-consent or in a separate survey if you wanted to, that help you assess the person's understanding of what's happening within the within items, within everything here. I realize I kind of forgot to mention it, but during the presentation, you can put videos and movies and interactive components into the fields. That's part of that multimedia piece. Okay, so then comes the decision, and REDCap really can't help you at the decision point right here. That's really up to the participant. It's not even up to the study team. That's solely on the participant. They have to make that decision on their own. But REDCap can then help you on the last piece, which is the documentation. So this is where you can capture that scribble signature or even an electronic signature if you're Part 11 compliant, and you can have the e-consent set up so that it sends it to the auto archive. You can optionally automate an email copy to of the informed consent document the participant signed directly to them. And then the next instrument you might want to have would be your documentation of your informed consent process so that all of the components of the process are together in one record. So how does the eConsent framework work? Well, first you start by entering into the consent in the survey mode, not in the data form mode, but in the survey mode. And the eConsent framework must be enabled onto the instrument when that occurs. Um, After the person goes through the form that you've created and they hit the submit button, it will go automatically to a certification page where that person then will document if they will see the document, the PDF of what they are signing, and they can scroll through that entire document, and then they can confirm that the document is correct and that they want to move forward. If they leave the page at this point, even though there's a signature on the inside REDCap, it's not considered a consent form. It is not considered, and there is an option for that signature to be removed if the person does not certify that they want to move forward. So in order for the consent to be auto-saved and to be considered consent form, they have to go through that certification step. The next thing that happens after they certify is a static copy of the consent-specific PDF is now stored inside the file repository. And when you're building the eConsent framework, there is a whole bunch of different optional items that you can place in there, things like the version of the consent, or you can have different fields like maybe date of birth or the participant's name put within the context of the footer of the cell. And you might even want to have something like the different types of um, consent form that you're doing. So you could have something like an adult, or you could say like a consent assent, or you could say something like so pediatrics, you could do something like that. All of those components, the values that you choose during that options phase, will go into the footer at the bottom of every single page on the static PDF form. So if you're ever looking at a consent form, and it doesn't have a footer, it's a copy of a consent form. It is not considered the real consent form. So the real consent form has a footer. And then you have the ability to optionally at that point have a confirmation email auto copy with an attachment um, of the form. That one's optional. If the person wants it printed off, you could print it off at that point. Okay, I feel like I have to take a moment to talk about um, scribble signatures and e-signatures and some of those components, because it's such a confusing place to be when you're talking about, oh, it's an electronic signature because it's on a stylus on a computer, and so therefore that was electronically done and therefore it's an electronic signature. But that's not true. That's not the way it works. So I have here, I went and I found the Federal Registry, and I dug through it and found the most important three comments in it. It's on page 13,443 of the Federal Registry. It was addressed in 1997 and it has never been updated because the FDA feels that what they have addressed then um, it, it works forever and they're not planning to change it. So basically, I think the thing to most important to see about this is that if the FDA, if you are writing using a stylus or a finger or a some type of pad or a pen on a pad or anything that you are putting on an electronic device, as long as you are signing it with what you would consider your signature, even if it's a scribbly one that doesn't look the same on paper, that is considered a handwritten signature by the FDA. And that basically, in REDCap terms, if you're using a signature field in REDCap terms, that's considered a handwritten signature. And it's not considered an electronic signature because it's placed directly on the PDF and it's auto archived, and that PDF is a static form. So you might see a signature and you might even be able to like delete data on a page in REDCap, but you can't delete that PDF form. You can't delete the signature on that form. You can't mess with it or change it. And that signature is what's called a scribble signature. So again, how do you know that what you are looking at is a true consent form? In the PDF, you look at the footer. Okay. So, how do you set up eConsent framework in your project? Well, first of all, you need to go to your surveys. You have to enable your surveys in the project setup page. Then on your online designer, you would go into the survey settings piece. And towards the bottom of that page, there is a place that says enable auto archive plus e-consent framework. So you would turn that on and you would select whatever optional fields you would want. And then you would save it at the bottom. And really, it truly is that simple. So when a participant uses it, how did they use eConsent? Well, they would open up their survey on a web page, and when they get to the bottom, they'd have an opportunity to fill some information out. They might hit the next page or the submit button. They might download stuff. And then at the bottom of the page, after they hit submit, then it would go to I certify comment. That's the certification page piece. And after that's after they say submit there, they are done on their side. At which point the PDF is placed in the file repository, and it's got a special tab in the file repository. If you wanted to download them, you could open them individually and download them. You could also download a bundle of them in a zip file. So let's take a look at what one would look like. So this is a demo consent. It really doesn't have a lot here. It doesn't. It just has the conceptual piece of what you would do. So maybe you have an exam. This is your beginning piece. So an introductory to the study. Would you be interested in seeing if you're eligible? And so you say, yes, I'm interested. When you get over here, we're going to pretend there was tons and tons of documents right here. at the top where you had all of your consent fields. When you're done reading and deciding all of those pieces and having a conversation back and forth with the person, you say you attest whether you do or don't want to consent. The person's name is added, then they put their signature, and a timestamp is captured and the primary email so that the person can get their copy. They hit the submit button or next page button, depending on who this is. This consenting person now has an individual obtaining consent because this happened in like face to face in this particular demo. So now the person that obtained consent signs, and then we can see a copy of the PDF that they're going to have with their signature in it. This is your certification page. They're going to certify by clicking on the button right here, and then they hit the submit button. And they're done. They could download the PDF if they wanted. All of these things are programmable and can be kind of specialized and things like that. Now, once that happens, let's see here. An email automatically went to the person. And, it says, hello, I'm a demo. Thank you for consenting to our study. Attached, you'll find a copy of your consent, and then you could put your contact information or whatever it is you wanted. The person could then open up their PDF and they could take a look or save it or do whatever it is they wanted to do with the PDF. And you can see in the footer here, in this particular case, it has I'm a demo, which is the name of the person, and the version, which is demo. And there's multiple pages to this one. All of these things, well, 99% of this stuff can be like changed and updated and made to look pretty the way you want it to look. Okay, so if I was in the project and I wanted to go see this specific one, I could come over here. I happen to know it's record 44, and I can open it. So now I'm the study staff looking at this. I could open it and I could say this one was provided on this day and time. And here is all of the information. I don't have the ability to edit it. It's locked. I can't change anything here. But I could do some other things, right? Now this demo doesn't have a process note, but it's just to give you an idea of how you would use REDCap for these things. So there's a few things that you have to think of at the very beginning before you say, okay, sign me up. I want to put eConsent on my project. So the first thing you have to say is, how is your participant going to reach your document? Like how are they getting there? Is the data team going to invite a specific person? If that was the case, then they enter in with a landing page, and the landing page goes to a survey, a consent document. Do you need to have assent documents too? And then is the last form, the process note, going to be a data form? So when you are building out your tree here, you have to think of what works within your study, and you need to go based on what your protocol says you're going to do. The other option is maybe you have a flyer or a website or something like that, and you're going to use a public link, in which case you're entering in your first record spot is a survey instead of a data form. So these are the kinds of things you need to think about when you are trying to build an e-consent. The next thing that you really need to make sure you're going to do if you want to have electronic informed consent procedures is your protocol language has to have the electronic steps written into it. You need to describe what each of the steps of the process is, why the steps are being performed, and how the steps are going to be performed. And the point here is that how are you making sure those 8 elements of the consent form are occurring, and not just the person is reading it, but that they're comprehending it and that they have the ability to ask questions, and that the signature or the attestation of the person doing it, the signature and the date captured meet the requirements per policy. So I do have some example protocol language that you could kind of cut and paste and put into your protocol, and in the red pieces you would kind of need to adjust, but you might need to adjust the whole thing based on what you're planning to do. And that can be found in, oops, sorry, that can be found here in the REDCap Resource Center, the Confluence page. Oh my goodness. Which is, I think I also have that in the resources at the back. The other thing you need to take into consideration are templates that you might need, letters for your invitation, like Dear Blank, we would like to invite you to participate in our study. If you are interested, click this link. That's a template for an invitation. So think of the letters that you might need to have automated in REDCap, and and I have some examples of those also on the resource page. Now, this is a very, very busy slide, and I don't really want to go through every single piece of it, but I just want to show you that building out your process has a lot of thinking that needs to occur during it, and a lot of processes that need to be written down and executed. Now, when you're building it, you think of it in a linear fashion. Um, so you want to think of the most ideal scenario, and then but be fluid enough to understand that sometimes the most ideal scenario doesn't occur, which is a protocol deviation. So this is here for you. If you can pause and look if you want. It also happens to be on the resource page, so you could go look there too. I have also created an eConsent development checklist, which kind of takes you through this exact same flow here. It's just every single one of these is a checkbox because you're going to want to build it in mostly this order. You could go a little out of order, but for the most part, this is the order you want to be in. So you could go in here and print it off on the resource page and use it to help you develop your own eConsent. Okay, so there's a lot of resources on the REDCap resource page, and then the FDA actually has some phenomenal guidance. But let's take a look really quickly at the REDCap resource page. So right here is the resources page, a documentation of the eConsent process, and there's tons of pieces here of information. And if you come on the left-hand side over here, there's even more bits and pieces that you could go into. Let me just take you to the front end. So this is what the REDCap Resource Center looks like from their homepage. Okay, if you need any help or assistance, the Resource Center is your first place. The second place is the CCTST does offer classes, so you could look at their calendar and see if there's anything that could help you there. And the third thing you might really need to consider doing is just go straight to the administrators, the REDCap administrators, and ask them for more information or help. They're amazing. There's very few of them, so you could get really good help if you needed to from them. And their email is help-redcap@bmi.cchmc.org. And I do believe that's the end of my presentation. Thank you for listening, and contact me if you have any questions.